After working as a cardiologist for over a decade, I've seen thousands of patients making critical mistakes when measuring their blood pressure at home. These errors can lead to unnecessary medication, misdiagnosis, or dangerous health decisions. I discovered this problem firsthand when my mother was taking 3 different blood pressure medications based on home readings. When I visited her, I noticed she was measuring incorrectly. After teaching her the proper technique, her readings dropped by 15 points. Her doctor subsequently reduced her medication, eliminating side effects that had been affecting her quality of life for years. Accurate blood pressure measurement isn't just a number. It's a window into your cardiovascular health. According to the American Heart Association, nearly half of American adults have hypertension, but many don't know it because of measuring errors. High blood pressure silently damages your body, increasing risk of heart attack, stroke, kidney damage, and vision loss. But incorrect readings can be equally dangerous, leading to improper treatment decisions. Let me walk you through the 11 most common mistakes people make and how to avoid them. Mistake 1. Using an uncalibrated or inappropriate device. Wrist and finger monitors are generally less accurate than upper arm cuffs. Research published in the Journal of Hypertension shows that validated upper arm monitors correlate best with clinical measurements. Check if your device is clinically validated at validatep.org. My patient Derek had been using an outdated wrist monitor showing normal readings, while his actual blood pressure was dangerously high. Switching to a validated upper arm cuff revealed the truth, allowing us to begin proper treatment before complications developed. Mistake 2. Incorrect cuff size. Using a cuff that's too small can artificially raise readings by 10 to 15 mmHg, while one that's too large may give falsely low readings. The bladder inside the cuff should encircle 80% of your upper arm. Measure your arm circumference and consult sizing charts for your specific device. Mistake 3. Poor body position during measurement. Sitting with your back unsupported, legs crossed, or arm incorrectly positioned can significantly skew results. The NI recommends sitting with your back supported, feet flat on the floor, and arm at heart level. Your arm should rest on a table or stable surface with the palm facing upward. Mistake 4. Failing to rest before measuring. Physical activity. Even walking upstairs can temporarily elevate blood pressure. According to Mayo Clinic guidelines, you should rest quietly for at least 5 minutes before taking a reading. Skipping this rest period is one of the most common mistakes I see patients make. Mistake 5. Talking during measurement. Speaking while the monitor is working can raise systolic pressure by 10 to 15 points. Remain completely quiet during the entire measurement process. Even listening to someone else talk can subtly increase your readings. Mistake 6. Measuring over clothing. The cuff should be placed on bare skin, not over sleeves. Even thin fabric can cause inaccurate readings. Always roll up your sleeve or remove clothing from your upper arm before measurement. Mistake 7. Incorrect cuff placement. The cuff should be positioned directly on your upper arm, with the bottom edge about 1 inch above your elbow crease. The center of the cuff, usually marked, should be aligned with your brachial artery. Incorrect placement is a major source of error that I frequently observe in my practice. Mistake 8. Checking blood pressure at inconsistent times. Blood pressure naturally fluctuates throughout the day. The American Heart Association recommends measuring at the same times daily, typically morning and evening. For most accurate tracking, measure before taking medications and avoid measuring right after meals. Mistake 9. Relying on a single reading. One measurement doesn't tell the complete story. Take 2 to 3 readings, 1 minute apart, and record the average. My patient Lisa discovered this when her first reading was always higher than subsequent ones due to white coat anxiety, even at home. Mistake 10. Holding your arm up without support. Supporting your arm with muscle power rather than resting it on a surface can raise your reading. This subtle mistake adds unnecessary stress, potentially increasing systolic pressure by 10 points according to research in the Journal of Hypertension. Mistake 11. Ignoring the impact of bladder fullness, caffeine, and temperature. A full bladder can raise systolic pressure by 10 to 15 points. Caffeine consumption within 30 minutes of measurement can temporarily elevate readings. Even room temperature matters. Colder environments may increase blood pressure while measuring.